Elimination disorders represent a significant category of childhood developmental challenges that affect millions of children worldwide, creating ripple effects that extend far beyond the immediate symptoms. These disorders, primarily encompassing enuresis and encopresis, involve the inappropriate elimination of urine or feces in children who have reached an age where bladder and bowel control would typically be expected. The complexity of elimination disorders lies not only in their physical manifestations, but also in their profound psychological, social, and familial implications that can shape a child's developmental trajectory. Enuresis, commonly known as bedwetting, affects approximately 15% of 5-year-old children and continues to impact roughly 5% of 10-year-olds. This condition involves repeated urination into bed or clothes, occurring at least twice weekly for 3 consecutive months in children aged 5 years or older. The disorder manifests in 2 primary forms: primary enuresis, where the child has never achieved consistent dryness, and secondary enuresis, where the child develops incontinence after a period of established bladder control. Nocturnal enuresis, occurring during sleep, represents the most common presentation, though diurnal enuresis during waking hours also significantly impacts affected children. Encopresis, the less common but equally distressing elimination disorder, involves repeated passage of feces into inappropriate places, such as clothing or floors. This condition affects approximately 1% of 5-year-olds and requires occurrence at least once monthly for 3 months in children aged 4 years or older. Like enuresis, encopresis presents in primary and secondary forms, with primary encopresis indicating the child never achieved appropriate toileting skills, while secondary encopresis develops after a period of established fecal continence. The condition often involves chronic constipation with overflow incontinence, creating a cycle of physical discomfort and psychological distress. The etiology of elimination disorders involves multiple interconnected factors spanning biological, psychological, and environmental domains. Genetic predisposition plays a substantial role, with children having affected parents showing significantly higher rates of these disorders. Neurobiological factors include delayed maturation of the central nervous system's control over elimination functions, reduced bladder capacity, and altered sleep arousal patterns that prevent children from responding to bodily signals during sleep. Hormonal imbalances, particularly reduced nighttime production of antidiuretic hormone, contribute to nocturnal enuresis by allowing continued urine production during sleep hours. Psychological factors significantly influence elimination disorders, with stress, trauma, and major life transitions frequently triggering onset or exacerbation. Children experiencing parental divorce, school changes, birth of siblings, or other significant stressors often develop secondary elimination disorders as their psychological resources become overwhelmed. Additionally, children with attention deficit hyperactivity disorder, autism spectrum disorders, or other developmental conditions show increased prevalence of elimination disorders, suggesting complex interactions between neurological development and elimination control. Environmental and social factors create additional layers of complexity in elimination disorders. Inconsistent toileting practices, inadequate bathroom facilities at school, cultural attitudes toward elimination, and family dynamics all influence the development and maintenance of these conditions. Children from chaotic or stressed family environments may struggle with the consistent routines necessary for establishing elimination control, while those facing social stigma may develop anxiety that perpetuates the problem. The impact of elimination disorders extends far beyond the immediate inconvenience of accidents. Children affected by these conditions frequently experience profound shame, embarrassment, and social isolation that can fundamentally alter their self-concept and social development. The stigma associated with elimination problems often leads to decreased self-esteem, social withdrawal, and reluctance to participate in normal childhood activities such as sleepovers, camping trips, or extended social gatherings. These limitations can create lasting effects on social skill development and peer relationships that persist even after the elimination disorder resolves. Academic performance may also suffer as children struggle with the stress and distraction of managing their condition. Anxiety about potential accidents can impair concentration and learning, while the physical discomfort associated with withholding behaviors or chronic constipation can further compromise academic engagement. Teachers and school personnel play crucial roles in supporting affected children while maintaining appropriate confidentiality and dignity. Family dynamics often become strained as parents struggle with frustration, worry, and uncertainty about how to address their child's elimination disorder. Siblings may feel embarrassed or resentful about limitations placed on family activities, while parents may disagree about appropriate responses or treatment approaches. The financial burden of managing elimination disorders, including increased laundry, protective materials, and potential medical treatments, adds additional stress to family systems. Effective treatment of elimination disorders requires comprehensive assessment and individualized intervention planning that addresses the multiple contributing factors. Medical evaluation rules out underlying physical conditions such as urinary tract infections, constipation, or anatomical abnormalities that may contribute to elimination problems. Behavioral interventions form the cornerstone of treatment, including establishment of regular toileting schedules, fluid management strategies, and reward systems that motivate appropriate elimination behaviors. Alarm systems represent highly effective treatments for nocturnal enuresis, using moisture detection to awaken children when urination begins, thereby conditioning appropriate arousal responses. These devices require consistent use and family commitment, but achieve success rates exceeding 70% when properly implemented. For Encopresis, treatment typically focuses on addressing underlying constipation through dietary modifications, adequate fluid intake, and sometimes medical interventions to restore normal bowel function. Psychological support plays an essential role in comprehensive treatment approaches, helping children develop coping strategies, address underlying stressors, and rebuild confidence. Family therapy may address dysfunctional patterns that contribute to the maintenance of elimination disorders while supporting parents in implementing consistent, supportive responses. School consultation ensures appropriate accommodations and support systems that minimize embarrassment and maximize the child's ability to participate fully in educational activities. Prevention strategies focus on promoting healthy elimination habits from early childhood, including regular toileting schedules, adequate fluid intake, and stress reduction techniques. Early identification and intervention for children showing signs of elimination difficulties can prevent the development of more severe problems and associated complications. Public education about the prevalence and treatability of elimination disorders helps reduce stigma and encourages families to seek appropriate support. Long-term outcomes for children with elimination disorders are generally positive when appropriate treatment is provided. Most children achieve resolution of their symptoms with consistent intervention, though the timeline varies considerably depending on individual factors and treatment adherence. Early intervention typically results in faster resolution and fewer associated complications, emphasizing the importance of prompt professional consultation when elimination disorders are suspected. Research continues to expand understanding of elimination disorders, exploring genetic markers, neurobiological mechanisms, and innovative treatment approaches. Advances in brain imaging technology provide new insights into the neurological basis of elimination control, while pharmacological research investigates targeted medications for resistant cases. Technology-enhanced interventions, including smartphone applications and sophisticated alarm systems, offer promising new tools for supporting children and families managing elimination disorders. The journey through elimination disorders requires patience, understanding, and comprehensive support from families, healthcare providers, and educational systems. Recognition that these conditions represent legitimate medical and psychological challenges rather than behavioral choices or parenting failures is essential for providing appropriate care and reducing stigma. With proper intervention and support, children with elimination disorders can overcome these challenges and develop healthy elimination habits that support their overall well-being and social development throughout their lives.